Okay, so if you're a dentist and you've heard about medical billing, maybe you've heard that Medicare pays dentists, I'm going to share with you in this presentation how you can get paid an extra $8,493.76 on your next dental case, and how we have discovered a little known but proven loophole that any dentist can use to increase their bottom line. Now, you can find a lot of varying opinions on how to do medical billing and how to send a medical claim. But I think everyone is missing the boat if they don't understand the integration part of it and the philosophy that makes this all work. So, this is part one of the series, and this is the introduction that I think every dentist or any dental admin should watch or go through before understanding, the why and the what and the how. So before we get into all of these things, let's just go ahead and I'm going to start off this presentation with asking, imagine you found out that somebody had been taking $50 out of every $100 that you make, or maybe they were taking $70 out of every $100 that you make, and they were doing this since the beginning of your practice. So you never really knew. You only lived off of the 50 or the little, bits, the crumbs that are left. So you never even knew something was wrong until somebody pointed out to you. Now, this is a hypothetical situation, but you're going to see why this question is so important and is a good analogy to what is going on in 97% of dental practices, and they just don't know it. So if this was the case, you don't have to answer it, but if you did want to comment below, let me know. Would you be happy or would you be upset? And you can just simply comment down below right now. Are you happy or upset if you found out that $50 or $70 of every $100 that you were making simply somebody was taking? Right? So what we have to understand is dentistry is the number one demand right now, and it's going to continue to grow. As people realize that health does start in the mouth, and 70% of all heart disease and breast cancer issues are actually oral health issues that are left, delayed, then this number is going to continue to increase. I mean, primary doctors, hospitals, nobody really cares to even go to the other doctors if they can go to the root cause and get the source of their issues taken care of first. Plus, I mean, we all know everybody likes a great smile. So let's go through and cover the who, the what, and the how of this whole system. And this system, by the way, HSFM stands for Health Starts from Mouth. And it is the name of this medical billing integration system and the way that we do medical billing in the practice, as well as the philosophy in which we think about everything that we're going to be talking about here. So the who is dentists, of course, you, and dental admins. Now, everybody knows the definition of dentist, but the big question that I think we need to all think about and consider is, if dentists are people, it's a person qualified to treat the diseases and conditions that affect the teeth and gums, doesn't it make sense that our first goal is to actually not just do the work, but get paid properly for it? And so what I'm pointing out is a lot of practices are taking dental insurance right now. So a fee-for-service practice, especially in today's modern world of credit cards, streamlined insurance billing, and clear compliance, a fee-for-service practice is probably the stupidest thing that any dentist or any growing practice can do. It's a surefire way to cut your profit, to limit the speed that your dental practice will grow, and it's just one of the stupidest things. So if you are doing fee for service, it's okay. You don't have to out yourself. You don't have to shout off to the rooftops. But I'm pretty sure that by the end of this presentation, if you are doing fee for service, at the very least you'll consider insurance again, and you'll realize that the reason was it's not insurance is bad, it's when you don't know how to do an insurance, or when you're doing it the wrong way. Of course, it's going to get you into trouble. and it's going to be difficult to run your practice around. So anyway, dentists, just realize that you are a person qualified to treat the diseases and conditions, and it would make sense that we would get paid for them first. But the question that I would have to ask is, what ADA code do you know that pays for the diseases and conditions, or treating of the disease and conditions? And so far, I've asked this to many dentists, and when I speak, publicly in groups or to admins, and it's the same thing. We don't have a single one. So medical billing isn't a matter of whether we should or should not. It's a matter of how we do it and why we must do it the right way. So I hope that makes sense. The what is integration, right? So it's not just medical billing. I think medical billing is the end result, or it's the side effect of, but the real thing that we're looking to do is integrate and work in coordination with the rest of the hospital and the healthcare systems. Even if you don't like hospitals, even if you don't like doctors, we're in the healthcare arena, and we should learn to work with and find doctors and other physicians, other providers that we can work with. Because as we've seen, dentistry is the number one demand in the US, and patients do want to see a dentist, and they know they need a dentist. But the more we collaborate, instead of thinking that it's going to be taking our patients away, it's the number one source of growing your practice and getting a steady referral of patients sent to you on a daily and weekly basis. Literally, I cannot stress this enough, but I'm going to share it because the stuff that I'm talking about may sound simple, but as Michael Jordan, or as many of the great people say, fundamentals aren't everything. They are the only thing. So we're going to practice these fundamentals, and I'm going to continue to share these in these videos, the things that really help you move the needle. I guarantee, unless if you have some secret sauce in running your practice, by implementing the health starts from mouth system, this is going to be the easiest way to grow your practice, to increase case acceptance, and to improve the quality and the standard of care for all of your patients, without increasing your overhead. Will drastically reduce, actually, in most cases, your overhead, your admin, and the time it takes for you to present these cases for patients. So at the end of the day, this is the single number one best thing that I've seen, not just for the admin, but for the practice in general, for the dentist and the patient. It's a true win-win-win for everybody involved. So the health starts from mouth system is much more than just a practice system for admins that are doing dental practices. And it's much more than just a simple way to get paid. It's a philosophy, and it is a way of thinking about talking to patients, communicating those needs to insurance companies, and properly getting the dentist paid or your provider paid for the work that they do. So the health starts from mouth system is a specific protocol, and it's a way of doing the dental practice. And again, everybody focuses on the money or the medical billing, but when you get the health starts from mouth system right, when you onboard or when you present the cases in a specific way, when you use the proper consent forms, so there's informed consent, then we're checking off all of the compliance pieces that we need inside a dental practice. And then when we do our case presentation, and as a health planner, someone that's trained, not just in a dental practice, the big problem that a lot of dental practices are getting into is, if you look at medical malpractice, 13.1% of all medical malpractices in dentistry. And if you look at 7 out of the top 10 reasons, it all has to do with delaying finances or financial, or delaying treatment because of financial. So at the end of the day, what I see is I see that there is a huge problem in the way that dental practice admins were trained. And it only makes sense that there's going to be higher malpractice and more problems in dental if we don't bridge this very important gap, which is patients need and want dentists for the medical benefit or the medical skills that they have. But if an admin is denying the use, the coverage of, and even the conversation of the medical aspects of dentistry, then not only are we going to be turning more patients away that we should be able to help, and that need our help, but we're literally turning away patients that have no option. And right now, 97% of dental practices are doing it. And Health Starts From Mouth system is the one system that has the answer for all of those different areas. It'll help you not only get paid for the doctor portion of the work that you're doing, it'll help you increase patient acceptance in a way that patients want to work with you. Because as a credentialed dentist, they can see that you're different. You know, it was like a 1% thing, and I think there's now 3%. So just by being credentialed, you're in the top 3% of dentists out there. And that's something that you should be proud of. So if anything other than just distinguishing yourself and separating yourself from the rest of the competition, you should be credentialed. But it really is the right thing to do before you ever start seeing patients and treating patients. But just no one talks about it. So here it is. It's your reminder now. There's 2 ways to get started with the Health Starts From Mouth system. The most important thing that you're going to want to do is you're going to want to hire a health planner or become a health planner. And I'm not talking about as the dentist, but if you're a dental admin or if you're an office manager, like I used to work inside the practice about 7 years ago. And I was trained in a conventional office and I wasn't taught this stuff. But when I went to a different practice and I was trained with my business partner now, who is a medical biller, and she was a RDEF, and her ex-husband also was a dentist, then she was not only specialized and trained in doing medical billing, but it was one of the few practices in Northern California that saw Medicare patients for the medical needs of their mouth. Now, we'll get into in other videos all of the different opportunities and all of the different ways to get more patients, to get referrals, and other opportunities to work with other doctors. That's truly incredible. I mean, even one of these connections, we've seen it not just increase the practice revenue and increase the number of new patients that our practice is getting in a substantial way, but we've seen them grow in the community. And for some of these people, it gives them the recognition or the reputation within the community to even go after, you know, other aspirations, even outside of dentistry. And we'll talk about that more and more, but that's not really the time and place for this. But most dentists are looking for, you know, whether it's a way out, because we should all have an exit strategy whenever we get into any business. So whether it's a way out or whether it's the way to do this efficiently, effectively, and really maximize the amount of money that you make for the work that you do, I think that you will agree by watching these series and presentations. This is the simplest thing that you can do, and the thing that will make the biggest difference in most practices out there. So if you have any questions, or if you want to see a case study of this, and if you want more information and resources on, you know, medical integration for your dental practice, then you want to go to upgrademypractice.com. The case study is at /proof, so you can go there if you want the case study. But either way, upgrademypractice.com or upgrademypractice.com/proof. And I hope you enjoyed this video. Let me know if you have any questions or comments about this process of dental medical integration, or if you'd like me to cover any topics on the upcoming videos, let me know below, and I'll be happy to answer that for you. Be sure to like this video if I provided any value for you, or if there was anything that you learned or liked. Be sure to like the video, and of course, if you want to see more videos like this, don't forget to subscribe to this channel.